Carilion Clinic is a not-for-profit healthcare system in Southwest Virginia. We have 7 hospitals and a multitude of clinics across this whole entire region. We have multiple states that we border, and we have over 45 hospitals that are transferring patients into our system. Peter Drucker is quoted to say, "Healthcare is the most complex human system derived on earth." So naturally, healthcare systems must have operations centers and continue to mature them to be high reliable.
As far as staffing within the center, we have ICU or emergency department trained nurses that will facilitate all of the transfer calls because they know the lingo, they know how to speak with providers. So it just makes it a very seamless process to get patients transferred into Carilion.
TeleTracking truly is our throughput software. From every aspect of the patient being admitted to being discharged, TeleTracking is there. If it's EVS needing a stat clean, clinical transport needing to be upgraded, or a patient needing to come from any of the outside facilities, it's all coming through this team.
You have real-time situation awareness of what beds are available, where in the hospital system, and there's limitations of duplication of processes. We've integrated these technologies in with our people and our processes to expand access to care and streamline the process through the hospital stay.
It's really about people, process, and technology all put together. We use a multitude of the suite of products from TeleTracking. We're able to track transfer center information very accurately with their modules.
So not only has TeleTracking helped us to leverage transfers into our facility, but also it allows us to see all of our availability within our healthcare system.
The one thing that we needed to do is we needed to have all our hospitals in the system on a TeleTracking platform so we know where every place in the hospital was where we had availability, space, and staff. And as we proved that it worked within our system, we were able to expand those.
TeleTracking actually saves us quite a bit of time. We can go to one source and look and see exactly what's going on with that patient, from pulling reports that are real-time reports to seeing any of the delays that are happening. That is a huge asset.
We've been able to reduce our occupied time, or time a patient has a ready bed but is still in the emergency department, by half. That's resulted in more than 3,000 more emergency department visits in that year. We removed a half a day of length of stay of our ICU patients by using the technology to drive performance improvement.
The technology has allowed us to prove year after year expansion in patient volumes. So we've maximized our bed count and able to staff those beds at almost 100%.
The ability for us to pull that data out of TeleTracking and then share it with leaders has really helped, I think, us bridge that gap between the different facilities and make it more like a system approach.
The technology has allowed us to track transfers in and patient through throughout the hospital system and determined that we had an increased number of transfers, which allowed us to develop a business case for hospital expansion. One of the biggest challenges we face with patient flow is actually the discharge.
Since we implemented TeleTracking within all of our facilities, as soon as a patient leaves their room and is discharged, it automatically makes the bed dirty and then sends the request to an environmental services employee to clean the room.
Our frontline folks and our leaders in the operations front really have confidence that we are making real-time decisions on real information. It's not lagging, and allows them to make the right decision for the right patient at the right time.
We've worked with our different TeleTracking representatives to set up our dashboards. We can personalize them how we need to for our facility. One of the main dashboards we use is our enterprise capacity dashboard. And so that is a very quick view to see really what's going on in all of our facilities at one time.
How do you design a system for different healthcare sizes and missions? The answers sometimes are not as clear as we would like them to be. And so the network of hospitals and healthcare systems that TeleTracking puts us together with helps us ideate, helps us partner so that we can make sure that we're making a shared decision, all of our collective input versus a single decision that may miss an opportunity.
I think we have to remember there's always someone waiting. And in this line of work, that could be life or death. So we have got to keep pushing the envelope and pushing the workflows and finding every second that we can save to make an impact.